başlattı.
Okay. Now this is an extreme varicocele case. This is grade 3 varicocele. I can see from outside there are many veins. So when I look to testicle, see this is an extreme intratesticular varicocele. So these are really decreasing the sperm count. His sperm count is 4 million in 1 cc, 1 milliliter, and this is because of the extreme varicocele, and we can easily see there are a lot of veins around the testis. Look at this vein, and this vein is calculated to be 3 millimeter in his Doppler ultrasonography. When I measure this, it's 3.7, 3.8, because we do it when the patient is in standing up position. When we do it like this, the veins are larger than. What is the importance of this? Because previously, doctor said to him there is no need for operation and he go for IVF. But IVF failed 2 times. So these extreme veins have to be taken out. I always recommend gynecologists, okay, you can do IVF, but after the IVF, please send your patients to us to clean these vessels, to get rid of these vessels. Look at this extreme intratesticular varices. And when we do Doppler, you see there is reflux inside the testis. Bakın biraz hocam. Okay, when he strains, you see a lot of vida. Yeah, so in the testis there is reflux. So of course this will affect. The blood is pushing back when he strains into the testicle, and it gives a lot of harm.